Worrying and the normal worry of motherhood is not the same as anxiety.
Right.
Anxiety is when it starts to really interfere with your functioning, with your bond. So a really good example is intrusive thoughts. You maybe had these.
Oh, I mean, it went on for years.
So it's when these images or thoughts pop into your head and you're like, where did that come from? That makes no sense. We actually have them all the time. But when we're not in an anxious or sort of vulnerable state, we're able to say like, oh, I just thought of my professor naked and that's really weird and I don't ever want to think about that again.
Right.
But when you're pregnant or when you're postpartum, like a big one for me is carrying my baby down the stairs and just imagining that I throw her out of my hands or she just rolls down the stairs.
Right.
It's really frightening. But in some ways, it's a protective mechanism. My brain is telling me, oh, hold on to your baby. Don't miss a step because this could happen. So I think it's us being like on hyperware. But I think many people have that thought and think, oh my God, do I want to harm my baby? What's wrong with me? I'm a terrible mother, etc.
I'm Susan Yara, and welcome to My Life Online. We're going to have a lot of fun and learn a lot together. When I was pregnant with my son, Nikash, he was my first, I feel like I constantly heard about postpartum depression. So it's something that I was really worried about, that I might experience this postpartum depression and not know what to do with it. But what I ended up actually experiencing was postpartum anxiety. And then when I finally started talking about it with my friends, I started to realize that many of us had experienced postpartum anxiety and we weren't really prepared for it mentally because all we had focused on was maybe we might get depression. So for today's episode, I decided to bring on Dr. Sarah Oreck. She is a board-certified psychiatrist. She specifically did a fellowship in reproductive psychiatry. And she also has a platform called Mavita Health that focuses on maternal mental health, which I think is so important because there are just so many issues that can arise, whether you're trying to get pregnant, you're going through your pregnancy, and also right after you have had your baby. And for today's topic, we're really focusing on postpartum anxiety, whether it's looking for the signs of it and what you can also do if you are dealing with it. I am so excited to have you on this episode because I personally experienced postpartum anxiety mostly with my first child. And then when I started talking to girlfriends about it, it seemed like all of us, everyone was dealing with it. And really what we always hear about is postpartum depression, which seems completely different. So I would love to, first off, have you tell everybody a little bit about your background and what you do.
I'm a reproductive psychiatrist. And really what that means is that I focus on how female reproductive hormones impact mental health. And we don't talk about that enough because when I was getting trained at Columbia University in New York as a general psychiatrist, I realized that all of the studies, and really in medical school too, all the studies are based on men, but really unique things happen to women's body, especially when they're conceiving, pregnant, and even perimenopause or due to our menstruation. But we're often kind of out of clinical trials just because we menstruate. So I was like, that's weird. And I also saw some of the best psychiatrists like have no idea what to do when they saw a pregnant patient. And I was like, what is going on here?
Yeah.
So I did a fellowship. I was lucky enough that Columbia has a specialty in women's mental health in this reproductive mental health sector, but people haven't heard of it or don't know that it exists. But it's really meant to kind of focus in on those times of big hormonal upheavals like pregnancy, postpartum, perimenopause. And I think it's a really exciting new sector of mental health that's going to be like substance use disorders and eating disorders in the future.
Can you explain the differences between postpartum anxiety and postpartum depression?
Yes, absolutely. So you'll hear people say, oh, she had postpartum. And that is starting to mean in our culture postpartum depression, which is really interesting. But like everyone that has a baby has postpartum.
Yeah, because that literally is what it means.
Right, exactly. But I think that postpartum depression is starting to be a lot more talked about. And that's really, people think of it as like sad or not being able to engage in the things that you used to like and that depressed mood with a lot of different features of maybe difficulty sleeping, appetite issues. But what's really interesting is depression can also look angry. It can look ragey. It can look irritable. So that's really important to think about. Mm-hmm. But we don't talk enough about postpartum anxiety, which is far more common.
Right.
So now we think they're underestimates generally because we're not screening enough for these things, but we think about 1 in 5 have anxiety. And studies show 1 in 8 has depression. I think these numbers are really low. I think it's more like 1 in 2 or 1 in 3 people suffer from anxiety or depression in the postpartum.
Right.
But I love that you're highlighting postpartum anxiety because it's so much more common. And I think it gets confused with those like natural worries of becoming a new mother.
Yeah.
And maybe why it was worse for you the first time around is because there were so many unknowns that it just like layers on versus when you have another child, like you already kind of knew what you were doing. worrying, but it's really important. Worrying and the normal worry of motherhood is not the same as anxiety.
Right.
Anxiety is when it starts to really interfere with your functioning, with your bond. So a really good example is intrusive thoughts. You maybe had these.
Oh, I mean, it went on for years.
Oh, yeah. Okay. So I'll explain what they are. So it's when these images or thoughts pop into your head and you're like, where did that come from? That makes no sense. We actually have them all the time. But when we're not in an anxious or sort of vulnerable state, we're able to say like, oh, I just thought of my professor naked and that's really weird and I don't ever want to think about that again.
Right.
But when you're pregnant or when you're postpartum, like a big one for me is carrying my baby down the stairs and just imagining that I throw her out of my hands or she just rolls down the stairs.
Right.
It's really frightening. But in some ways, it's a protective mechanism. My brain is telling me, oh, hold on to your baby. Don't miss a step because this could happen. So I think it's us being like on hyperware. But I think many people have that thought and think, oh my God, do I want to harm my baby? What's wrong with me? I'm a terrible mother, etc. So I think it's really important to bring some, I think, normalization to this, but that still doesn't mean if it's really disturbing that you should live with it.
You know, on that note, some of my intrusive thoughts, and this is when I realized it started becoming debilitating.
Yes.
Where I could be laying in bed with my son and imagine a crazy car accident, and it was like Final Destination kind of stuff happening in my mind, and we're just laying in bed.
I know.
He's sleeping peacefully,
Yeah.
and I would start being like, I would start crying, and it was like, why am I going this far?
I know. It's really, and in some ways, I think there's a lot with birth and mortality. You just gave life to someone, and so you, of course, think about what it means to not have that life or for it to be over. But I think these disturbing thoughts can become so difficult to manage. And that's a great example. You're just trying to be present with your son. And meanwhile, your mind is absolutely somewhere else, like worst case scenario. And that's an example of like intervention is really important because it's taking away that time with your child.
Right. A lot of friends warned me about the baby blues.
Yes.
Is that different from the anxiety?
Yes, totally different. So baby blues happens to 85% of people who deliver a baby, and it happens in the first 2 weeks after delivery. And it's like these fluctuations in mood. So it's these people who are like, I'm so joyful, and then all of a sudden they're crying, and it's kind of this up and down. And sometimes there's like low mood. But what's really different and distinct from depression, for example, is that they feel hope. They're like, I'm not sleeping right now, but I know this is just the beginning and things are going to get better and it's going to be great. And that's really different. What we think is if it crosses over and continues 3-4 weeks, we're probably in the territory of depression or anxiety and past that baby blues kind of window. But sometimes baby blues can come up and go away in about 2 weeks. They peak at 5 days postpartum. And so I usually like to kind of sit tight until week 3 to see what's happening. Obviously, that's barring like any suicidal thoughts or really significant illness.
Right. And I guess that's a good distinction, I guess, that timeline, because I feel like I started with the baby blues.
Yeah.
And then it continued and continued and continued for like,
snowballed into anxiety.
And it took like a year or two before I was really out of that anxiety.
But I think when people are like, oh, it's just the baby blues, don't worry about it. It's a little dismissive, frankly.
Yeah.
So I really think past 2 weeks, like, you know, something else may be going on. And I think it's so great to have these conversations kind of open up because having this knowledge even before you get pregnant just sets you up for success. You know what's happening. You know what may come instead of sort of being surprised.
Right. I don't know why this came over me. There was one of our family members was home with us the first day that we had brought our baby home. And she started saying to me, she could obviously tell something was going on with my mood. Yeah. And she said, postpartum depression's a real thing. And it pissed me off.
Well, you know,
I felt like I had just given birth.
Yes.
And maybe I was having some anxiety and maybe I was going through some feelings, right?
Yeah, well, you felt a little judged.
Yeah.
Right. Or like there was an assumption being made. I think it's really important how we address things. That's why I like doing it before pregnancy. And so for people just to know about this so they don't feel like then, you know, Susan, you may need some help here or whatever. Yeah. That doesn't feel so good. But I think it's just being curious. Like, do you know about postpartum depression? I had postpartum depression. You know, those types of things I think can be a little bit easier. Curiosity. How are you feeling? How are you doing before accusing someone or telling someone how they feel or what they're experiencing? that's a way to set someone off. And I suspect that that's what's happening.
Exactly. So you're saying this is hormones that are playing the big part in this.
So a huge part is hormones, but I want to be clear. It can be a lot. It can be multifactorial. So a great example is people who have struggles with fertility and use IVF, they're probably at a higher risk for postpartum depression or anxiety. Similarly, if you have an unstable household, if you're getting a divorce and you just had a baby, that's going to be a huge stressor. So there's also other stressors that can add to it. Traumatic births is a great example. You thought your birth was going to go a certain way and it went a completely different way. That can all kind of set you up for this postpartum depression or anxiety. But largely what we think is happening is that typically you might be resilient towards that, right? You might have like an accident or an operation, your appendix out, and you can get through it, even if it was traumatic. But you add on this hormonal fluctuation and you're not as resilient as you used to be. So again, it's layering on top of that. And we really do think that hormones has a lot to do with it because your hormones, especially your female reproductive hormones like progesterone and estrogen, really increase to their highest level during the third trimester and they plummet to their lowest level postpartum. You never experience that drastic of a shift in hormones ever in your life.
So, oh my gosh, I had no idea.
So it's a big deal.
Yeah.
And your brain is affected by that. Your body's affected. And so all of those things, what we think is makes people less resilient. Something that maybe in another part of their life, they would have been able to be like, yeah, it was difficult, but I got over it.
Yeah.
Makes it really difficult.
I mean, I track my cycle.
Good.
And
That's great.
and I can tell when I'm starting to feel real down or I feel like I'm ugly or something.
Yes, you know what's happening.
I just check the app and I'm like,
yes. And so that's usually the 2 weeks before your period for some people. Some people have like terrible ovulations. So it really varies. And we're still like at the very beginning of understanding a lot of these mechanisms.
All right. Well, so if a mom is pregnant
Yeah.
and you're trying to kind of coach her through what she could feel or experience, what are some of the things that you're telling her to just mentally prep for it?
Yeah, I mean, I love preventative health and sort of being able to lay down the foundation to like, here's what can happen and here's how we can prevent those things. You know, I really start off with pregnancy is also a vulnerable time.
Yes.
And actually a third of cases of depression and anxiety in the postpartum start during pregnancy.
That makes sense.
Yeah.
Again, that first child, I had no idea. A woman who's like in the prime of her career, I've done everything with research and experience, and then I'm going into having a baby and I have no idea what's being told to me, what to expect.
I mean, it's really hard. And then like the amount of changes your body goes through, if you have any body image issues, like pregnancy really throws things out of whack. And so I first say like, you can experience things in the pregnancy, even though for some people it's like, I should be so grateful. My friend's struggling to conceive, but I think it's still really hard and those things can start in pregnancy. And it's really important to get them treated. So if you are having a lot of anxiety, depression, or any other mental health issue, because untreated illness actually affects your fetus as well. People are very concerned of like, oh, but if I take medications, there'll be an effect. But untreated depression, anxiety, and any kind of mood or mental health issue, we are seeing result in preterm delivery, more C-sections, just different complications during the birth, and then sort of significant impacts on the baby throughout their life.
That is so interesting to know.
So that's where I start off. And then I say, if that's not the case, then in postpartum, you can have these issues. But what prevents it from happening? A really good support system. That means, and I know people talk about the village a lot and they're like, where the heck's my village?
Yeah.
But it's really about us making the effort to figure out how can we parent with our friends if we don't have family in town? Like, how do you make that community so you don't feel alone? Because support is literally the number one prevention for all of these issues. You know, you might have the kind of genetic vulnerability or the hormonal vulnerability to get postpartum depression, but I bet you if you have a support system behind you, you are going to get better much faster. And it's going to be easier.
Right.
So that's my main one. Then it's sleep. Right. How do you get sleep when you have an infant? It's really difficult. But this is where you tap your village, or if you can, sort of use resources for a night nurse. I know it's an expensive thing, but it's so much better of an investment than a really fancy stroller.
I agree.
And really fancy strollers are expensive now, right? But like if you take those $1,000 towards someone helping you at home for a week or two, like that is a much better investment and sort of shifting your attention towards not the goods, because people are just obsessed with like the nursery and
Right.
the crib and but like taking care of yourself is going to be most important. Nutrition is one, sleep. I mean, I could go on, but
Right.
those things can really set you up for success.
Well, even for someone who can afford it, like for instance, with my second child, I could have absolutely afforded a night nurse, but there's this part of me that's like
Pride?
it's not even pride. It's like an
Martyr?
Yeah, maybe. I don't know. I guess I was like, I can do this because I want to be there for my
Yes,
daughter.
yes.
Kind of feeling. And I look back on it and I'm like, why?
I know.
Why didn't I go
Why?
ahead and hire somebody to help me with this? And I even feel like with my first child, people would say to me, sleep when the baby sleeps. And I'd be like, how?
How does that work?
Yeah, how does this work? And so people would be giving me this advice, like sleep when you can, get as much sleep. But this just feels like people are almost insulting you by telling you to sleep. You know what I mean? So
It's like, don't you think I've tried?
Yeah, exactly. So what advice do you give to people when you're saying to them sleep? What if they can't afford a night nurse though, for real?
I mean, and then I think it's really important to think about, so if you had this baby with other people, some people don't want to ask for help. Or, there's this myth of motherhood in our country and in some cultures that you somehow have to do it by yourself. And it's not an individual sport. And it's really a family system problem. So that means maybe someone needs to take off of work. I know you may not have a great relationship with your mother-in-law, but maybe it's time to have her in your home so you can get some sleep. Like really strategize that. But I see a lot of resistance where I think people can help and feeling like either pride, ego, oh, my friend did this by herself, so I should too. And I just think it's really misaligned. I really think we need to question it because it's just not what motherhood's meant to be. And motherhood in that isolation just sets you up for mood issues, depression, anxiety, and like a loss of identity as well.
Yes, very much so. I mean, I feel like I didn't even notice my loss of identity. My son's 8 until like a year ago.
Stop.
I started realizing, I was like,
who am I? What's
why
going on
haven't
here?
I been working out? Why don't I like do my hair more? Why don't I do
Yes.
X, Y, and Z?
Yes.
Like,
Or
I
things
just
that used to
stopped.
be important to
Yeah.
you. Yeah,
It stopped because I suddenly had excuses for why I didn't need to do those things right now. Or it was like too selfish or something.
Yeah, that's right. And I think sometimes, yes, it's fine to give up your makeup routine and take care of your baby. But I think if that's something that really is your self-care, and if it gives you a sense of, oh, I'm looking good, I'm looking nice, like that is so important. Because I think, and this is so, like people say this all the time, but you cannot fill from an empty cup. And I think that is so right. And fine, it's not makeup for you're doing your nails, but like whatever it is, if it's reading a particular type of book or cooking up a pasta, like just do it. Because in the end, though it feels in the moment, oh, am I selfish to not be playing on the floor with my son? I think ultimately when you invest in yourself, you'll find that the times that you are present with your child, you're not distracted, you're not thinking about all the other things you should be doing. But it's hard because we're kind of told not to do that.
Yeah, it really is. I mean, it's so sad that we let that kind of take over our brains, right? All right, so then let's say we're postpartum.
Yes.
And the baby blues kick in first.
Yeah.
Okay. What should we be doing to manage that? Because especially since so many people go through that.
Yeah, exactly. I think that's the key of like, where's my support? What do I need right now? Where's my sleep? Where's my nutrition? I think nutrition really falls off. People are so focused on feeding their child that they forget to feed themselves. And when you are breastfeeding, you need more calories. But even when you're just recovering, some people may have a major surgery. They had a C-section and they need that great nutrition. I mean, there are some cultures that literally like feed moms in bed for 40 days.
This is Korean culture, right? We get like essentially like it's either our mom comes in or our grandma comes in and like cooks for us for a couple weeks, or we actually hire somebody and that person's there to take care of mom. And so
Latin American too. My family's Colombian, and that's absolutely the case. People are taking care of mom, not just of baby.
Yeah.
But here in the U.S., that's sort of lost. We're like, you don't matter anymore and just taking care of the baby. I mean, we see that in the hospital.
Yeah.
I had like 3 C-sections and they just like threw the baby, be like, take care of it. Don't you dare sleep.
I know.
And I'm like, I just had a surgery. Would you tell the person that had, like a back surgery? No.
I know.
No, in no other hospital do they tell a person who just had a major surgery to like take care of another human being.
Oh, I know.
It makes no sense.
Again, back to my first child, that was one of those, people have told me it's not actually called an emergency C-section when you're like giving birth and then you have to be told to go into a C-section. Yeah. But I had one of those.
Where you did both.
I did both.
That's great.
I was trying to get,
yeah,
it was
like
amazing.
2 for 1. Yeah.
So I got the adrenaline shakes, which is what I found out it was called later, where I was just like, I felt like I couldn't breathe and it
hold the baby.
Was terrible. And I remember, first off, like I heard him cry and I wasn't really having a reaction because I felt so numb.
Yeah, of course.
And then suddenly they're plopping him on my chest and I'm like, huh? And I remember I was like, I actually said no. And I just felt somebody lift my arm, put it over him, and lift my other arm. And I just was rolled out of that room with the baby on my chest and my arms just wrapped around him. And to be fair, I did start feeling better. They told me I'm going to start feeling better if I have him on my chest. But at first I was like, oh my gosh, what are they doing?
Yeah, it's so wild. Then I think it's really important to kind of figure out the nutrition, the movement, how can you kind of recruit people in your life to take care of you?
Yeah.
And I know that sounds so strange, but who can do your laundry? Who can take things off of your plate?
Yep.
Because once we do that, we find that can relieve a lot of these mood issues that are happening. And I think with baby blues, a lot of what's happening, obviously it's the hormonal fluctuations, but also this huge change has happened in your life. And just like adolescence, we call it matrescence, this transformation to motherhood. It's important to have support. Like imagine teenagers, right?
Yeah.
And what it's like and how awkward you feel and that's different. But having like parents that are there for you and a peer group that's there for you can make all the difference.
I feel like I started having babies a little bit later than most of my friends. So then it felt like I had a hard time finding people going through the same thing.
Yeah.
But talking to my friends who had gone through it definitely made me feel a lot better. The other thing that I found out after I'd already had my baby, so I didn't get to experience this, but I didn't realize there were postpartum doulas.
Yes.
Also, which makes complete sense because that's pretty much somebody who's there to come help mom.
Come help mom. Sometimes they cook. It's really incredible. But I think there's these creative ways that we can help. And I know that sometimes paying for these things, again, is not always possible. But I do think it's also about shifting your values because I do know a lot of people who will pay a lot for, a special type of bassinet that's electronic or different things. And I think there's importance in kind of prioritizing the self-care or the people. So I think that's a little bit of a value shift. I think with the thing, it's like, oh, I have it here. Look at this thing. But those services can sometimes be even more helpful.
Right. Even if it's just for that first week, right?
Yeah.
It'll make a huge difference.
That's how I feel about mental health support. And why I created Mavita Health is really a telehealth platform to support mental health through this journey. And it was all cash pay at some point. That was my private practice. But now we're in network with Aetna, Cigna, and Blue Cross and Blue Shield. But I think with mental health, a lot of times people don't prioritize it. They'd rather spend it on something else. But ultimately, it's a really good investment because it teaches you some great coping skills. It helps you kind of navigate along this. So sometimes when you're feeling these baby blues and let's say you've recruited all your supports, you're eating fine, you're sleeping, and it's still not getting better, sometimes just getting into a therapist to kind of discuss this huge change that you've gone through can be really helpful in preventing that depression or the more significant anxiety.
Do you think there are other things are there exercises that you recommend for somebody, like breathing exercises?
I love breathing exercises. That's something I personally do, and I love meditation. I think those are hard to do if you're not doing a practice already.
Oh, I see.
So I would say start that off when you're not in an acute or a difficult place. Start in pregnancy.
Yeah.
People love hypnobirthing, and that's kind of some of that work.
Yeah.
So I think if you can do those when you're not stressed and you're having a good time, that's something you can definitely recruit. I love that. I also think movement, just gentle walking, going outside, being in nature. We know that those things can impact mental health significantly.
Yeah. I mean, that makes complete sense. Again, back to my first child, I felt like I didn't leave the house for a month.
Yeah.
Second one, I was like, let's go.
Let's go out. And that's probably something that was really good for you and that filled your cup in some ways to see your friends or to go out to a restaurant, whatever you like to do.
Yeah. Okay. So we're past the 2-week mark.
Yes.
Baby blues are still going strong. Now we're starting to veer into this might be anxiety, maybe even depression.
Yes.
So first off, how do you start to identify?
I think it's hard sometimes when you're in it.
Yeah.
And you probably had this too.
Yeah.
I felt like sometimes after the birth of I was just like in such a fog.
Mm-hmm.
And so I think that's where it's important to have really open dialogue with your partner and your family. And this can be like done beforehand, almost like a pre-counseling of like, here's what to look for. Here are the red flags. How can you approach me without telling me, Susan, you're depressed?
Yeah, exactly. And then
like
pissing me off.
That's not right. Exactly. That's not helpful. So it's like, oh, I've been noticing you're not getting out of bed that much. Like what's happening there? Are you really tired? What can I help with? Those kinds of things, and like softly approaching it. And, ultimately I would love for everyone to have like reached out to a therapist or have had like an open line of communication, because it can be so hard to get in once you're in a lot of distress.
And you like need it right then and there. So do people generally find you like either before they get pregnant or
That's what we
during?
like.
Okay.
I've had some people who kind of like know this or have heard it from friends. And so they're like, I just want to make an appointment, do my intake so you know about me. And if I need you, I'll call back. And like, that's great because you're already a patient. They know that sometimes that intake process can kind of jam up. Not at Mavita Health. We see patients in 2 days. But most systems, you'll find mental health care, you have to be on a wait list for months and months and months, especially if it's not going to be out of network.
What are those tools then when you start getting into the postpartum anxiety? And actually, can we talk about the different types of postpartum anxiety? Because we talked about intrusive thoughts, but I feel like
There's so much.
Yeah.
Okay, so we talk about postpartum anxiety, but there's a bunch of different anxiety disorders that actually fall under the umbrella. So one is like generalized anxiety, and it can look a little different in people who are in the postpartum, but what we often find is a lot of health anxiety comes up. Is something wrong with my baby? Oh, something's different with my baby. Like, checking the temperature constantly. Another really good example is like when baby's finally asleep, you can't let them be because you want to make sure that they're breathing, for example, or you have one of these devices that doesn't help that much in soothing your anxiety. So that's one of the big features that we see. Or your own health, concern about your own health, whether you're going to be okay to take care of your baby. That's also a big thing I see. Then sometimes it escalates to obsessive compulsive disorder. And this is where we see intrusive thoughts, these repetitive sort of obsessional thoughts. We have panic disorder, which is having panic attacks, as well as post-traumatic stress disorder is an anxiety disorder. And we see PTSD often after a traumatic birth.
Right. That makes sense. I mean, shoot, if we end up I have so many friends who I was kind of okay with the C-section, but I had so many friends who just had their birth plan.
It's so hard. Yeah.
Kind of they just didn't want to veer from that birth plan. And they definitely wanted to skip the surgery.
And that rigidity can be really difficult. And then it feels like, something was done to my body. And so for some people, they may have like flashbacks of being in the OR or of that situation. They may have nightmares. They may just have a lot of trauma. I mean, I've had some patients that had trouble going back to the hospital or back to see their OB because of how traumatic that experience is. And so imagine that kind of stops you from getting the care that you need.
Right. So you identify, you have at least some type of anxiety.
Right. Yeah. And so you identify it, your partner or someone around you is like, hey, I've had this before. A friend is like, I had the same exact thing. Here's what I did. So I think from there, if you're already in the thick of it, it's pretty hard to just say do lifestyle modifications. I don't know if you just tried to like go work out a little bit. I know sometimes I did that because I struggled with like, should I? I mean, I've been in therapy for a long time, but the decision between medication or not. So I was like, I'll just exercise more or I'll meditate more. I'll go to yoga. So certainly lifestyle modifications can help, or I'll eat better.
Right.
But I think once you're really in it and you're not making decisions that are aligned with your values, like you're not with your kids as much, or you're sleeping in all day, or you're avoiding things because you're so anxious, I think it's time to get into therapy. And for mild to moderate anxiety or depression, talk therapy is the right move.
Right.
I know a lot of OBGYNs will just kind of throw an SSRI at you, but actually the evidence-based thing to do is to start therapy first. But because it's so inaccessible in our country, we go straight to the med.
Right. And the meds are fine.
They're great.
Yeah.
They work. They're fantastic. But what I like to do is sort of do the therapy and then layer on the medications as another tool in your toolbox when things are severe. So when you're like so anxious that you can't leave or you're having panic attacks, like medications and therapy, starting that at the same time may be indicated.
Yeah.
So I think that's important. And yes, to kind of normalize the fact that medications can help you. And that's okay. It doesn't mean you're a failure. It doesn't mean you're a bad mom.
Yeah.
It just means you might need a little bit more support. It's just another tool. That's what I like to, how to like to break
some
it down.
women, when they're breastfeeding, are afraid to take any new medication, right?
Yeah.
But is there a problem with that, or?
No, so actually SSRIs, which are selective serotonin reuptake inhibitors, are the most popular kind of medications used for anxiety and depression. And in fact, they're the most well-studied in pregnancy, which is really interesting, more than the diabetes med, more than the blood pressure med that you would never turn down, right?
Right.
Because like that's a health issue.
Right.
Well, so are mental health issues. And what's really interesting is that during the pregnancy, there's no increased risk of congenital defects. So that's really exciting. And then in the postpartum, they barely get into the breast milk. And so often we measure the baby serum, that's their blood, to like see if there's active medication, and we don't even find any. So very small amounts get into the breast milk. And ultimately, we think because breastfeeding is so important and so good for you, for the people that can do it.
Right.
I want to be clear. If it's not working for you,
then it's not working. Yeah.
it's not working. There's great formulas to augment with. But if it is working with you, that we'd rather you breastfeed.
Yeah.
Because that also can be preventative for depression and anxiety and bonds you to your baby, but to also use the medication.
Yeah, that makes sense. If they don't want to go to a therapist, see a therapist, which we know comes up a lot. So I know it's not what you're advocating for, to like stay at home and deal with it. But let's say you're kind of fighting yourself on it, because I know I fought myself. I don't even know why, but I did, right? Because I'm progressive in the mindset of like, I believe in therapy.
Well, it's interesting. I think when we are like high achieving, there's this thing of like somehow I think we can logically get our minds around it. Like, this is science-based. This is good. People get better. But there's something about still this moralistic, puritanical, like, but not for me.
Yeah.
I'm good.
Yeah.
I'm stronger than that.
Yeah. And I don't know why, but I definitely did that to myself, where I just felt like I needed to
I've done that to myself.
Go through it.
And this is my career. But like for me, growing up in a Latin American household where I was told from as a young child, oh no, you just have to be strong.
Yeah.
Like, just don't complain. You just have to be strong. Anxiety is just like something that's happening in your mind, but you can somehow think yourself out of it or something.
Right.
was like what I was told. And so that's still there.
Yeah, it's crazy. So for the people like us who will fight it, what are some of the things that, if we're starting to at least maybe to ourselves admit it, that we're having some anxiety, what are some at-home tools besides the nutrition, all that stuff? Like, again, back to like breathing techniques or like telling yourself.
Yeah, I think YouTube has a really fantastic trove of like meditations, breath exercises, and I'm sure you can plug in like postpartum meditations to start off with. On our app on Mavita Health, we have evidence-based content that you can kind of do on your own. You can do meditations. You can do almost like these self-help assignments to make you reflect on what your values are. Because those shift a lot during motherhood. If you are acting in a way that's aligned with them, that kind of probe you to make some changes or to think about those things. And you can do that all by yourself.
Yeah.
You don't need anyone else. Also on our app, and this exists all over the internet as well, communities.
Right.
If you don't want to go out and like find that community because maybe you're having too many symptoms, right? And you don't want to be in a mom group where, you know, a lot of the mommy groups start to like just compare developmental milestones, and that becomes really difficult for people who are like.
Are you saying in person or like Facebook?
No. So I was saying if you don't want to do those in-person things, there's Facebook groups. There are so many places to connect with like-minded mothers.
Yeah.
And now you can find anyone dealing with anything.
It's crazy.
Yeah.
Yeah. It turns out we're not very special.
No, we're all going through the same things. And I think those can be really good resources. I am going to say, like, our community chats have moderation. And sometimes those, like, on social media don't.
Yeah.
And so my concern is sometimes there's a lot of, like, misinformation.
Right.
You know, if you want something that's more moderated, certainly find that. But people are sharing their stories. I mean, for some people, it's like just going on Reddit and reading about other people's experiences. That can be like, oh, I'm not the only one. And here, I just had to go on Reddit to find it.
I mean, this is why Reddit's so big.
Yeah, exactly.
Terrible stuff on there too, but there's also great stuff on there.
Exactly.
You know, the other thing that I feel like is a big factor is that you have a spouse or a partner And sometimes they don't necessarily understand what you're going through. They just kind of like are seeing this. You can be asking them. You could be, everyone says communicate, but sometimes you communicate and you're over communicating. It's actually just building this resentment and anxiety. So what are ways that we can work with our partners maybe before the actual baby comes to help them help us?
I love that in some, religious groups, they do like premarital counseling. Mm-hmm. And that's like a huge part of like, if you want to get married in this church or synagogue, you have to go through this program. Mm-hmm. I think that's so cool because it's preventative. And in the same way, like we offer couples therapy for that purpose. I think it's so important to dispel the myth that like you have to be at the brink of divorce to get couples therapy. Actually, no, you can have it at any time. And as you transition to new roles, that's often important. If you can't do that, I would say start talking about the realities of what may happen. Oh, hey, I just heard about postpartum anxiety and depression. Can I tell you a little bit about it? And here are the warning signs. Or I've had, if you've had a history of depression or anxiety, you can tell your partner, here are my signs. This is when that things are starting to become difficult. But I think if it's just like hitting a wall and not going anywhere, instead of building that resentment, that rage, I think it's really important to say, hey, let's talk with someone who's objective. Whether that's a paid couples counselor or if you're religious, whether that's sort of, that happens in some churches and temples where you can go to your religious figure and kind of get that care. Mm-hmm. I think that's so important.
I mean, I see this all the time.
Even with friends, so they can see if there's another partner that you think has been enlightened and knows a little bit more, to be like, with the couples and hear another man speaking about it can sometimes be helpful.
Too bad there aren't a lot of them floating around out there.
I know.
Because I definitely see this a lot. Whenever I am talking to a friend and they're like, just a few months out or even a year after having the baby, I feel like their biggest complaint starts to be their spouse.
Like they don't get the experience.
Yeah. And sometimes the spouse will say things that you're like, what?
I know. I just think there has to be a lot of education in general. And I think often with a lot of other mental health platforms, it's been like, it's the woman's job. But I have always thought about this as a family systems issue. Yeah. Actually, dads can get postpartum depression as well.
I mean, I imagine.
About 1 in 10 does.
Really?
Yeah. And
it has nothing to do with hormones, though.
No, this one, but what's interesting is even non-birthing parents have changes that happen in their brain. So pregnant people, their brain changes, so do non-birthing parents. And so those changes can also make you somewhat vulnerable to postpartum depression, as well as like this huge change. Yeah. You weren't a father before and suddenly you are. And so I think, this is a really bigger discussion of like how men in our culture access their feelings, talk about things. And I think if we have boys to raise, I have 2, it's really important for me to start off from a very young place of like, here are feelings, this is acceptable, you can cry. Because I think unfortunately a lot of the men in our lives are very kind of restricted in their emotional kind of language and expression. And this can lead to a lot of issues, including like dismissal or like not validating other people's experience.
Yeah. Is there anything else people should know about postpartum anxiety?
Just that it's so common, but even if it's common and it happened to your friend and it happened to your sister, it doesn't mean that you have to suffer through it.
Right. None of us should.
No.
But it's also normal.
It's also normal. Like you did nothing wrong. This isn't your fault. It's not because you didn't read something or because you drank 3 margaritas before you got pregnant. Like it has nothing to do with it. It just happens. But getting help is also, I think, a sign of strength. And that's ultimately what's helped me. And I know that once I've been in treatment or have taken a medication, I'm like, I'm really proud of myself because I am kind of showing up as the parent I want to show up as. But, that can be a hard journey. But there are places that support you. We are here for you.
Well, thank you so much for being here. Truly an important conversation. I think this only is the tip of the iceberg,
yes,
right?
There's so much to this.
More. But where can people find you if they do want to get more information?
On Instagram, I'm on @SarahOreckMD, and you can follow Mavita Health @Mavita Health. You can also get care if you're in California, New York, and New Jersey @MavitaHealth.com.
Amazing. Thank you so much.
Thank you for having me, Susan.
Thanks for joining us on this episode of My Life Online. If you enjoyed this podcast, make sure to follow, rate, and review, and also share it with a friend so we can continue making great episodes for you. You can also find me on social media. I'm @Susan Yara, and if you enjoy beauty, especially skincare, make sure to check out my YouTube channel, Mixed Makeup. I'll talk to you soon.